Welcome to the stream. Thank you so much for joining. I'm Dr. Sylvia. I'm a GP with a special interest in women's health and sexual and reproductive health care. I'm also the founder of AskAwayHealth. I think I've done like 4 streams, and this is the first time I'm saying that this morning. Goodness, or this afternoon. How are you guys doing? Okay, so we are looking at the doctor's mailbag today. So I've been talking about and answering different questions that have come into the platform, onto my channel, as I often do, because I think that's a really great way for us to learn. Just a quick disclaimer here that I do not provide medical advice or treatment, because I can't. I don't know your medical background. I'm not your physician. You really need to sit down in front of somebody who you're registered with. They know your medical background. They have access to your medical records, and then they can examine you and provide the right treatment. It is the least that you deserve. But here we can definitely talk about symptoms. We can definitely talk about conditions. We can definitely demystify jargon. We can definitely address any kind of false information, and all of us can learn together, and this is the purpose of the channel. So as you have seen on the title, which is probably why you clicked onto this video, we've got a situation here. We have got a situation. So my sister sent in, well, not my exact sister, but my sister sent in this message. She says she's had this lump. After it popped up, it's not gone back down to its normal appearance. The swelling is still there, and it seems to have popped up again. Will it ever get back to normal, or is it just going to stay the same? What can she do to make it back to its usual appearance? So this is a quandary. This is a situation. So we don't know the ins and outs. We don't know anything more than what I've just read out to you. Meanwhile, shout out to the lady who sent in this question. Thank you. I appreciate you for sending in your questions. I feel really honored and privileged that you would trust me, if you like, to go through it and just provide you some guidance. I don't mind just holding your hand and explaining what might be going on. But my sweetheart, I do say go back to your doctor so they can make sure that you're getting the right treatment. So obviously this is a panic-inducing situation. Let's not lie to ourselves, girls. If we feel something down there, you begin, what's going on? What does this mean? What's this? What's that? And the other. I understand. Been there, done that. Let us be honest with ourselves. So I brought my friend to help us talk through this. So some of you might have seen me with my little model here in the past. And this is so that I make sure that we're all on the same page, so that you understand what I'm saying. Please don't forget to give this video a like. It is really appreciated. And guess what? It is free. So please do me a favor and give the video a like. Okay, so this is a model of the woman's vulva. Okay, so we're just going to talk through this very quickly. The bit in pink, bright pink here, is the vagina. Okay, and the bit above, that little dot in pink as well, is your urinary opening or the bladder opening. Okay, so it's all sitting in within this space. At the very top here in brown is the clitoris, and the darker brown surrounding is the inner lips or the smaller lips of the vagina. So usually called the labia minora, but they are the lips of the vulval lips, the smaller ones, because there are 2 sets. Because just outside you have the bigger lips. So this is a big model, but just trying to help you think about this. If you're sort of lying down and looking at yourself in a mirror, this is what you're looking at. Above here, where my hand is where we'll grow up towards your mons pubis area, which is where the hair is. Okay, so just so that we have some orientation. For girls that experience Bartholin's cysts, and I talk a lot about Bartholin's cysts on this video. See where my finger is? Towards the bottom bit, that's the usual site of the Bartholin's glands. So when you get a Bartholin's lump or cyst or abscess, this is either here or there, usually towards the lower part of the vulva stroke vagina. So and the vagina itself, like the vagina is a tube. It's a tube. I'm not trying to be nasty or offensive or anything like that. I just put my finger there to signify that it's a channel. All of this here is the vulva, okay? But the vagina is a tube that you enter through here, and then as it advances, the cervix, the first part of the womb, is slightly jutting into the vagina. Okay. Usually when I'm doing my live streams, I would have, if I do them on StreamYard, I would have a lot of graphics so that you can see what I'm describing. But anyway, that's just to make sure that we're all on the same page. What is the issue? The issue is that somewhere along this slide, we don't know, the sister has got a lump somewhere in this area. We don't know whether it's at the top, somewhere maybe coming from her hair, because it could be a folliculitis for all we know, or maybe somewhere along here. It might even be a Bartholin's cyst, actually. We don't know, because she hasn't specifically told us. But I just wanted to use that to sort of keep us in context. So the problem is that it has popped up and then it's settled. I think she's implying that it was treated. I don't know how, she didn't say, but then it's popped up again. I'm also not clear whether it's one of those things that popped up and then she popped it Do you know what I mean? We all do it. Like I said, let's not lie to ourselves. Today, let us be truthful. You know how it is. You get a fleshy thing. Some of us have educated ourselves enough to resist poking or squeezing at pimples and things. But sometimes we all feel, oh, let's just give it a squeeze and get rid of whatever is causing the problem. So it may be that she's giving it a squeeze, thinking that she can treat it or get rid of something, and it has not happened. So she's worried. Is it going to stay swelling forever? What can she do about it? So I think the first thing is, anytime that you squeeze or try to pop a pimple, your body feels as if something has been done to it. Your body feels as if, oh, there's an attack, quote unquote. So an inflammatory process starts off from just your action of squeezing. That's why when you squeeze, pimples, they go red. Even if pus comes out, they might go red. You have triggered, by just that activity, you've triggered something, and the body will send fluid. It will send your body defense white blood cells to the area to fight, to repair, and try and get things coming back to normal. So the swelling might be as a result of her doing that, is possible, or it may be that it got swollen and that's part of the condition. Again, it's not very clear, but either way, the question is what to do next. Is it going to get better? Now, sometimes if it's something like an ingrown hair, it may get infected. It may not get better without treatment. And then once you've had a course of treatment, the swelling settles and it all resolves. If it's something like a baffling cyst that is not going to get better by itself, but might even progress into an abscess, then it's going to stay large. In fact, the baffling cyst will keep getting, you won't need anybody to tell you or to cajole you to go and see your doctor, okay? So it depends on what is causing it. If it's something that you squeezed or you popped it, and then you went off to sleep thinking that you've dealt with it, you even put some, and I don't advise you to do this, so you put something on it. I don't want to mention anything, so you don't say, oh, the doctor said use this. You may have put something on it. You may have bought something from the chemist shop and put something on it. You know what I mean? I don't want to give you any ideas. And you've gone to sleep thinking that it's all settled. You wake up the following day and, oh, it's popped up again, a very stubborn visitor. So in that instance, what should you do? I think the first thing is just stop. Stop popping, stop squeezing, and stop panicking and stop worrying, okay? How big is it? How painful is it? Is there anything coming out of it? Do you have any other symptoms? Because if you say that it's quite large, what size do I give you? I mean, I'm not going to give you any specific size. It could vary, because I don't want you to think that, oh, if it's very tiny, just don't bother. I think if it's very small, but it's really painful, you should go. I think if it's very large and it's not causing pain, but you don't know what it is, it just arrived from nowhere, I think you should go as well. So that's why I can't give you any specific size. But if it's growing bigger, then definitely go and see somebody, okay? So those are important aspects. The first thing is stop panicking. The second thing is go and see somebody about it, especially if there are those changes. But maybe it's something that hasn't really changed. It's not changed size. It seems to be about the same. It's not doing anything. So maybe what you want to do is just keep an eye on it for another day or two, right? You could do things, for example, just using a very gentle compress against your skin. Of course, it goes without saying how important it is to keep the area clean and dry. No douching. You don't need any special antibacterial or anti-anything soap. You just need clean water, mild soap to clean this area, okay? Clean the hair, clean your mons pubis, and clean the labia, the outer labia, the big labia and the little labia, and clean the space in between, okay? And dry gently with a clean towel, and wear cotton, preferably cotton underwear, so that your skin can breathe, okay? So that's what you need to do. And then from time to time, perhaps a couple of times or 3 times a day, if you have a defined lump, a lump that you can feel this is different to the rest, you can apply a compress against it just to see that will make any difference. Now, if it doesn't make any difference, and that could help, especially if it's painful. If it doesn't make any difference, that is when you definitely need to go and see your doctor. I don't think it's appropriate to sort of ask blindly, okay? Ask blindly about, just a second, let me see. There's something that just popped up. Oh, Ah, let me take this away. Sorry, I was distracting myself. Okay. Hope you can still see me because I don't know why I clicked on this. Okay, I think we're good. So, I've distracted myself. So if you have something like this that you're concerned about, please don't be shy to come and see your doctor. Okay, doctors have seen this. Our job is not to embarrass you or to make you feel unwanted or make you feel silly. So please, please don't feel that way. So if you're just joining, we're just tackling a question that came into the channel where somebody has a troublesome vulval lump that is not going away. I've tossed in a few possibilities. We've said folliculitis, we've said a Bartholin cyst, we've said an ingrown hair. It could be a wart. So there are different things that could possibly happen in that area. Some are pretty much benign, not too alarming, but some could be quite serious, so serious infections, even cancer. And so you shouldn't ignore them. I always advise that it's important to get it checked out. Let me know what you guys think. If you have a lump that just seems to be persisting, not going away, you've tried to treat it with your over-the-counter chemist things that I will not mention, but I know that we do, and it's not better after a couple of days, or you feel it's getting worse, what's your next step? How would you handle it? To the lovely lady who sent in this question, I hope it's helped. I know you said you want to know what you can do to get back to the usual appearance. It depends on what is causing it. If we know what's causing it and then we get the treatment right, then it will usually settle down. Okay, so I can't tell you what to do to get back to the usual appearance without knowing what is causing it, and there's quite a few possibilities. I've also got a very popular video on the channel. I will probably tag it on this video once we finish, so that you can go and have a watch, where I look at 7 possible causes of vulval vaginal lumps. I think you'll find it very helpful. Over 2 million people have found it helpful, but I think you'll find it helpful as well. Anyway, guys, thank you so much for watching. I hope you found this a useful contribution to this topic. Give this video a like as well when you're watching the replay. Don't forget to send in your questions. Hi to, is it Harsh, who sent a love emoji? That's lovely. Thank you so much for that, Harsh. And hope you found that helpful. I don't know from your name. I'm not 100% sure. But yes, thank you so much for checking in. Guys, I'll see you again soon. Mwah! Love you. Bye-bye.